A lot of people suffer from headaches. The challenge about helping patients with headaches is that there are many different things which cause headaches. So if we start with patients that are suffering with sinus headaches, if this is what's contributing to your head pain, typically, you're going to be suffering from, either a head cold of some sort, chronic sinusitis, or potentially even seasonal allergies. And typically this pain tends to be in the front of the head, around the frontal bone, or in this part of the head where you have sinuses clustered. Oftentimes, this pain may get worse with changes in head position. You may feel better laying down, may feel better sitting up. It may get worse if you travel by air in an aircraft, for example, and swimming may make a difference. And so usually these headaches are fairly easy for patients to identify. One of the things I recommend for my patients that you can get at drugstore is a neti pot. In fact, the one that I prefer is called NeilMed, and what this is a plastic bottle that you put a saline solution in, and you actually will push saline up one side and let it drain out the other in the sink. And you do half the bottle on one side and half the bottle on the other. This is a great way to clean out the nasal passages. Oftentimes this will help open up the nose. This will filter out any pollen or any antigens that you have in your nose. For example, if it's allergy season, it'll help filter out the pollen that is stuck in the hairs inside your nose. And even if you're sick, oftentimes I'll do this if I even have a cold, but my nose is really starting to bother me as I lay down to sleep at night. I do find that I get a benefit by cleansing those nasal passages before I go to bed. On top of that, if you're suffering from chronic sinusitis or seasonal allergies, or this kind of head pain that's related to sinus irritation, some patients can also get some benefit from the eucalyptus oil. They do find that does open up the nose, at least temporarily. Having the eucalyptus salt, sometimes I've had patients put those in diffusers that you can buy at some of the Bath and Body Works or places like that, where you put the drops of the oil in a small votive candle to heat it up and let your bedroom get that eucalyptus or peppermint smell. That can oftentimes help open if you're looking for a natural solution. There's also a lot of over-the-counter decongestants and allergy medications that can help if your sinus difficulties stem more from allergies. So you can get Zyrtec over the counter, which is a good antihistamine that isn't quite as sedating as many of the older generation antihistamines. And Flonase, a nasal steroid, is also over the counter. And so many patients have a lot of luck with those two medications as well. Acupuncture and osteopathic manipulation are excellent for sinus congestion, whether it's from allergies, chronic sinusitis, or from a head cold. By working on the bones of the head and the neck, we're able to increase the venous drainage. We're able to help get those immune cells into the head. We're able to work on all the soft tissues that are congested and help decongest and help the body drain. I've had many patients with chronic sinusitis trying to avoid sinus surgery. Usually what we try to do is we usually treat those patients fairly aggressively for several weeks, and that usually gives us a good indication of whether that patient's going to respond to that treatment and whether they can avoid surgery or whether they need to go through with it. Another common cause of headaches is tension headaches. Oftentimes I find this comes from tension in the shoulder and neck muscles. Certainly sitting at a computer and working frequently or texting frequently on your phone certainly aggravates the muscles in this region. As those muscles get tight, they start to hurt. Anytime we overuse a muscle, it starts to cause pain. That pain can oftentimes radiate into the head and cause pretty significant headaches. I'm usually not a fan of anti-inflammatories, which most people take for head pain or headaches. Typically I'll recommend Tylenol if you need to take anything. One of the best treatments that I do if I don't have any medication and I am getting a tension headache is I'll find a towel, oftentimes a bath towel, and I'll fold it in half. So we have the long section, so we'll fold it down the short side, and then I roll it up like a jelly roll. So I have a little roll. And then what I do is I'll lay down on the floor and I'll put that right in the curve of my neck, and I'll lay down on the floor. And the difficulty here, the hard part, is you want to relax. And what that does is as I rest on the floor, and you have to relax, that's key, that supports the neck while all those muscles and tissues are able to decompress. you're able to let the tension melt out of the head. Those muscles are able to relax. The nerves are able to calm down. That's an important part. And most patients find that that helps relieve their tension headache, or at a minimum reduces it significantly. A lot of patients complain about headache, but specifically they find that it radiates behind one eye. A couple of things that can cause this. I find two major culprits, but actually they're actually related to the same muscle. Oftentimes tension in this muscle that runs from right behind your ear to your collarbone, trigger points in that muscle oftentimes will cause pain that radiates behind the eye. One, we want to figure out why that muscle is upset. Oftentimes this has to do with untreated injury where the muscle inserts to the bone, and that can be easily fixed with prolotherapy. You can look at my videos on prolotherapy to learn more about that. But sometimes some simple stretching activities can help as well. Using a towel roll is excellent. You take a bath towel, roll it up like a jelly roll, and then simply lay down on that and let these muscles in the front of the neck relax. As that muscle relaxes, and as the tension drops away, and you have to relax, that's key, oftentimes that will also reduce the amount of nerve signaling that's going to the muscle, and that will actually help reduce the pain and tenderness and alleviate that referred pain back to behind the eye. If that doesn't help, then sometimes what we'll need to do is look at acupuncture. It can be very effective for these kinds of headaches. I've had many patients respond well to a combination of acupuncture and osteopathic manipulation that helps make sure the collarbone is sitting properly, to make sure that the base of the skull where it attaches to the neck is working well. And then once we are able to get those working, we can calm down that muscle. Acupuncture helps work on some of your some of the pain stimulation, some of the nerves and the hormone levels, helps rebalance those. And if needed, sometimes we need to use prolotherapy to tune up the area where that muscle inserts to the bone, and that is oftentimes very effective for tension type headaches.